Hi and welcome everyone. I have noon, so I'm going to go ahead and get us started. It's so weird to be able to see myself in one of the COVID calls, so I'm going to have to get used to that. But welcome, I'm Melissa Southwick, and we are here for October 5th COVID call. Unfortunately, Molly is not able to join us today. She is helping out a family member right now. So we have a pretty packed agenda, and we're going to go ahead and kick us off with Amy telling us about the new platform that we're using. Amy?
Great. Melissa, could you advance your slides for me?
Sure can. Give me 1 second.
Okay. So welcome everyone. As y'all know, we have moved here from GoToTraining to Zoom. So with Zoom, there are a couple of different things for Zoom webinar that we just wanted to run you through. So I'm going to talk about two. I'm going to talk about chat and audio. You'll see raise hands on one of the other screens. Just ignore that. On some of these webinars, we will use raise hands and we will use a Q&A feature. On this one, we are not. So can you go to the next slide, please, Melissa? So if you want to chat with us for any reason, in the bottom of your toolbar, there is a chat box. You'll see that at the bottom of the screen here. There's a little chat feature. If you click on that, there'll be a chat box that will pop up. On there, you can see that there's, if there are chats, they will pop up at the very top in the body of that box. But then there's a blue box where if you click on that arrow, can you go to the next slide, Melissa? It'll allow you to chat with all of the panelists or the panelists and attendees. So the three of us who are on screen right now are panelists. We are people who are speaking, so you can chat directly with us or you can chat with us and the attendees. It's totally up to you. For any tech stuff, you probably want to just chat with us, but any questions, you may want the attendees to see them as well. So that's where you can post that. Can you go to the next slide, please?
So Amy, we did have a chat from Carol that she doesn't have any sound. If anyone can hear us, let us know in the chat and we'll keep going. And I can try to talk with Carol through chat as to why she might not be having sound.
Oh, okay, sounds like everyone else can. So Carol, it sounds like it's on your end. This is one of those things with Zoom. So you'll have to see, check the sound in your own soundbar in your computer because the sound is coming through loud and clear for us. Okay, so the next thing is with the audio settings. So in the lower left corner of your thing, so if you're familiar with Zoom, there are different settings in the lower corners than you have in Zoom meetings versus Zoom webinars. So in the lower audio settings, if you want to, Carol, this was perfect. We didn't even pay you to do this. You can check your audio settings to see if that's why you're having issues hearing us. So if you click on that little up arrow next to audio settings, you'll get that box that'll pop up where you can adjust your settings. And I would suggest, Carol, that you go to your audio settings, or if you're having trouble hearing through your computer, you can click on leave computer audio, and that will allow you to get off of computer audio and give you a phone number that you can call in on. So that might be an option for you. But it sounds like the rest of the folks on the call can hear us, which is great. Okay, and I think that's the last slide for me, Melissa. Is that right? Or did I add in any others? Okay, perfect. Awesome.
Nope, that was it. And I did
Okay.
chat into Carol about checking her own sound, but it occurs to me she probably can't hear the advice we're giving her. So Amy, maybe if you can chat with her through the chat, that would be helpful.
Okay, no worries. Thank you.
No, yeah, absolutely. Thank you. Okay, so just a quick rundown of some of the stuff that we're going to cover today. And as always, taking a pause to give you guys time to put anything in the chat that you're hoping that we can cover. This isn't extensive, but we're going to talk about social isolation and loneliness. We're going to talk about pets. We're going to talk about substance use, Halloween, and voting. And I have to say, as I was putting the slide together, I realized it felt like it was kind of all over the map. But I think that that's because it's becoming evident that this is going to last longer than we had anticipated. And so with that in mind, as we're thinking about sort of the long haul with this, these are all things that came up for us. So a little bit of a mismatch and like kind of everything thrown into the pot together, but we'll get through it. Please chat in any questions if you have them. We're going to start with the numbers as we always do. And I have to say that you'll see in Minnesota this time there's an asterisk next to the currently hospitalized. And that is because I wasn't able to find their current hospitalization numbers for you all out there in Minnesota. It looks like they keep a cumulative total, which I may have been reporting on them past and not even realized, but I did realize it this time. And so, as near as I can tell, there's currently 100 people hospitalized with COVID in Minnesota, and 50 of them are in ICU. But that's what that asterisk means. And that's also from a weekly update that was done on 9/26. So they're only updating those hospital numbers once a week now. I also have to say that it looks like Rhode Island is also only doing weekly updates now on Tuesdays. So this information here is from last Tuesday. And I think that that's just kind of telling that maybe as we're going into this for 6 months now and a little longer, we're starting to realize that daily updates might be a bit much for people to keep up with. So they're starting to update a little less frequently. But those are the numbers as they stand right now. Casey?
Casey, you're muted. There you go.
Melissa, you're zoomed in on your slide, so we can't, I'm not sure if other people are seeing that same view.
Nope, I don't see that.
Okay, must just be my screen, so that's fine. All right. Hi, everybody. I'm Casey, the health systems educator. This is a map from the CDC website from last Saturday, and I've been sharing these maps with the nurses to kind of highlight the rapid spread across the country. So while Vermont continues to be one of the safest places in the country, this map indicates the huge importance of staying vigilant. There have been over 300,000 new cases in the last week. Cases, deaths, and hospitalizations are rising as people move more inside and as schools have reopened. Of course, the news of President Trump and many White House staff testing positive last week has also likely increased the anxiety level for many of our participants, regardless of their political beliefs, just knowing that he was able to get infected and get sick. So clearly the virus is out of control in much of the country. So I wanted to give you some updates on the next slide, Melissa.
Casey, if you're zoomed in, you may not be able to see all of this. Is that right?
I can see it. That's okay.
Okay.
Thank you. So worldwide, there have been 35 million cases and over 1 million deaths. India is currently on track to overtake the United States in total cases with over 100,000 new positive cases daily. And I just bring that up. There's a little bit of kind of number fatigue, that these numbers get so big that they start to not mean anything. And in some ways, I think that's why the president's case is kind of highlighted to people that it is also affecting individuals. So just increasing understanding of how huge this is a problem around the world. In Vermont, there's also been some continued confusion about testing. Some practices are using the point of care antigen tests, which provides the result in about 15 minutes. New guidance came out from the state of Vermont last week about the use of these tests. They are currently recommended only for people with symptoms. The antigens test is quick, but it's also less accurate and can produce both false negatives and false positives. A positive antigen test will trigger a response by the Department of Health, including initiating quarantine and contact tracing. However, the test will not be added to the official tally, and it won't show up on the health department COVID tracker until it's confirmed by a PCR test, which might take a few days. The reason they are doing that is that the PCR test is considered much more accurate. However, as we've seen in a couple of communities around the state recently, the false positive antigen tests lead to a legitimate community response where schools are closed or businesses are closed, and then that gets reversed a week later when a negative PCR is reported. So that's definitely leading to some confusion and some misunderstandings about how that all works. 2 weeks ago on this call, we reported that the CDC had changed its guidance to indicate that the coronavirus is spread by airborne transmission. And then The day after that call, they removed that from the website. I'm sure you've heard about all that controversy. It was apparently posted by mistake. The distinction between airborne and droplet precautions has to do with the size of the pieces of virus and how long they float in the air. A change in this guidance would not likely change the personal protection recommendations for our SASH work. It would be mostly affect healthcare providers caring for positive patients. So as confusing as all of that is and the changing guidance, it's not going to directly affect us at this time. And then finally, I just wanted to do a brief vaccines. There is a lot of excitement and good news about several vaccine candidates that are showing promise. It is anticipated that a vaccine will become available for more widespread distribution in early 2021. However, there are a few issues with the vaccines that will greatly affect its ability to end the pandemic. And I want to share these because I know that some organizations are waiting for a vaccine to reopen or to restart activities, and that could still be a long ways off. In order for a vaccine to be approved, in order for it to be FDA approved, it has to be at least 50% effective. Hopefully it will be more than that. But if they can get a vaccine that's 50% effective, then it is likely to be approved by the FDA. And of course, it's safe. And the willingness of people to get the vaccine is also going to be a huge issue. So with a little bit of math here, if the vaccine is 50% effective and 50% of the population get it, that only actually protects 25% of the population. And that's not close to the needed 60 to 70% we need for herd immunity. So that's a challenge. You know, just getting a vaccine out and just getting a whole bunch of people to take it is still not going to end the virus completely. So a couple of other additional challenges is distribution, keeping millions and millions of doses cold or potentially even frozen, depending on the vaccine that passes. There may be multiple doses required, and there's concern about supply shortages, which could potentially slow the vaccine's ability to help us return to normal. So I share all of this with you mostly just to highlight that we still have a long road ahead of us. And as we're going into winter, going into the dark time of the year, certainly social isolation is going to become more and more of an issue for our folks. And I will pause here to see if there's any questions on all of that, but then we're going to turn it over to Dory to talk about her project on social isolation.
So Casey, the only chat that's come in is from Jody Velarde, and she said it's been clarified that the antigen testing can be considered a screening testing prior to PCR, and that she found that distinction helpful. No other questions though. So Dory, if you are ready, Dory is our our SASH fellow from UVM, and I'll give you a chance to introduce yourself because you're clearly going to do better than I am with this. But she's working on social isolation, and so we wanted to give her a chance to share some of what she's working on, and hopefully she'll be building towards a training that we can all look at again later. Dory, are you on the call?
Yeah, I'm here. Can you hear me?
We can. Hi, thanks Dory. Thanks for joining us.
Yeah. So as Melissa said, I'm Dory. I'm SASH fellow. I'm a student at the Larner College of Medicine, and I've started working with you guys just because, I don't know, this whole COVID thing has made everything complicated, and I just wanted to be able to do something during this time. A lot of us are doing clinicals, and it's just hard with all the testing, and some people don't want to see students, so I thought I'd do something that I could be doing something every day. But then, I don't know, this social isolation piece has really interested me, and Molly reached out and was like, hey, do you want to do something with this? And I was like, yes, this is very exciting to me. So I'm glad I can be doing this with everybody. But I've been working on this project. Right now, it's just kind of in its beginning stages. So we wanted to kind of share what I've done so far, just because it's so timely. So I didn't want to wait until this training was done, whenever I finish it, to just kind of talk to you guys about this sort of thing. So I'll just go over a few highlights I have that can be helpful. All right, next, Melissa. So this little illustration was just, it kind of highlights a few of the problems we face with this elderly population as a consequence of loneliness and social isolation, usually together, but sometimes a separate thing. So they're extremely vulnerable at this point. Just seeing all these little, factoids, the negative ramifications of the social isolation. They've been equated to the health risks of high blood pressure, physical inactivity, obesity, or smoking 15 cigarettes a day. There's a lot of other little facts too, but those are the big things. Melissa? And then this figure was also very interesting to me, and it makes a lot of sense. It's kind of complicated when I talk about it, but if you think about it as the level of socialization increases, your COVID infection risk increases also. But as you socialize with more people, your loneliness and social isolation decreases, which is, what we want to do. We want to hang out with people, but your infection risk will increase. And conversely, if we stop interacting with people, our risk decreases of getting the COVID infection, but our social isolation loneliness risk kind of goes through the roof. So it's a hard balance to try to stabilize this. So it's a big issue that we should be aware of and trying to help our participants in any way we can. So Melissa, next. So this was just one piece. So I've created this huge document of interventions I've found from various people sending me stuff and looking online. But this was kind of a basic, easy thing for participants to kind of just do by themselves. Just having structure for the day, starting something to get you going, thinking about short term instead of, what's going to happen this winter, or like, when is this going to end? Where's the vaccine? Just trying to stay in the moment, reminding yourself to try to focus on positive things, just helping them plan something to do every day, maybe just a phone call or watching TV, something. Go outside as much as you can. I know with the winter coming up, that's kind of an issue too. So inside, I have a lot of internet resources. I think on my next slide, it has a big list of things. But essentially, and talk about your worries with other family members or friends you have, just kind of trying to stay connected to the people that you can, and just activities that distract you from all of this stuff and just things that make you happy. But those are just like simple things you can, talk to your participant about, just be like, hey, just try this, or whatever. And then next slide, Melissa. And so this is a messy slide, but this is just the first 4 pages of my document. You probably can't see much of it, but it's just a list of everything I've put together. So I think there's like zoos and aquariums and what else? Yoga, physical activity, internet resources, phone resources, just a lot of things I put together. And I've tried to make it so it doesn't repeat itself. So everything's in there just once. But next slide, Melissa. Okay, so that's all I had. It's so I don't know. I have a lot of resources. I have like 8 pages of the resources, and I just wanted to get everyone's input. So if you have something that you've done with a participant or you've heard of that would be good as an intervention, just send it to me and I can add it to that list. And I just want to make that list, I don't know, I want it to keep growing. And I'm going to share it with you guys after the webinar. So you can see what I have so far. It'll give you something, to hold on to and use and kind of refer back to, give you some ideas to, things to try with your participants. Otherwise, that's kind of, I don't know, those are the highlights I wanted to touch on, just kind of things we can start doing. But with my training, I'm going to go start, talking about risk factors, other little facts, information on social isolation, screening methods, how we determine what the needs are of our participants, and then how we can offer support for them. But for now, that's all I have. I know it's pretty brief, but I can also answer any questions if there are things you really want to know about at this time, and I'm happy to get that email from you.
So Dory, thank you so much. A couple people have chimed in asking if they can get the printout, so that's great that you'll be sharing that. We can share it after the call. And like Dory said, if you have things that you've done that aren't on this list, please let her know about that. But I would also add, if you have anything on this list that you try and it was wildly successful, or if you tried it and it wasn't successful, let us know your feedback as well, because we can kind of even hone the list a little bit and say, like, you know, this received rave reviews, this one was a little tricky. I think that the idea is just almost like doing a group share document of like gathering all the information that's out there. And especially as we go into winter, as Casey was saying, it's going to become even more important. So thank you so much, Dory, for sharing this with us. And please, everyone on the call, let us know. We will send the list out afterwards. Unfortunately, we have a lot to get through today, so I'm not going to put it back up, but we will share it afterwards. And I'm glad that you're so interested in seeing it. And thank you, Dory, for sharing it. So I'm going to move us along. And the next thing we're going to talk about really briefly is just voting. There's a lot on this slide, but basically what I wanted to let everyone know is that in Vermont, everyone that's registered is getting a mailed ballot. They should have gotten them already or be getting them very soon. And you need to mail that back in by October 24th or deliver it to your town clerk if you're going to do that, if you're going to vote remotely. You have to sign the envelope. There's lots of little nuances to making sure that this works, and we wanted to make sure that you all got those. If you vote in person, you have to bring with you the paper ballots that were mailed to you as a way of showing that you're not trying to vote twice. So you didn't mail it in and then show up at the polls. You can drop your ballot off on election day. All ballots must be received by 7 p.m. and some of your participants may be confused about getting all of these processes together. So that's why we wanted to share this. A couple other things in the top right-hand side, you'll see just a picture of this beat that most recently went out on Friday, because there's also some FAQs for Rhode Island and Minnesota as well, so that you can know what you need to do for voting in your area. And the comic is one that I saw this weekend on vpr.org, and it just cracked me up that in talking about how Vermonters vote, they did it with a cow. So I wanted to share that with you all, but honestly, the guidance is really great. So if that's something that you wanted to share with your participants, I think you could probably do that as well. Next is Halloween. So Halloween is coming up. And I'm not going to read this slide to you because there's a lot on it, but we've been hearing people wondering what we're going to do. A lot of times our sites will host local kids to come in and walk around the building and do trick-or-treating. And should we do that this time or not? And so mainly, I don't feel like we can necessarily make that decision for you, but we wanted to give you the guidance to have while you're trying to figure that out. So in here, there's some lower risk activities that could be done maybe virtually or outdoors. There's some moderate risk activities, and then they're letting you know what the higher risk activities are. And it's at the CDC website down here. So we can get that up on STAR as well after the call for you to have as you consider what you're going to do at your sites. We heard on the nurse call last week that there's an issue happening with bubble packs around the state of Vermont. I'm not sure, I'm sorry, what's happening with them in Rhode Island or Minnesota, but if you're finding that there's trouble there, please let me know and we can look for resources for you as well. But bubble packs, apparently what we've heard is that it requires the pharmacy staff to be really close together to make those happen. And so there's some places that just aren't doing them anymore, or there's some places that aren't delivering anymore. And so this has become a problem for some people. And we heard on the call these 4 pharmacies that can bubble pack and deliver anywhere throughout the state. The thing with Kinney Drugs, I just want to point out, is a little different because apparently they have a processing center in Waterbury possibly, and they can do the bubble packs from there and mail them out, but you have to have a form filled out. The rest of them, it's just a phone call. And I will say that the pill pack by Amazon, we heard, doesn't work as well as some of the others, because if you have a prescription change mid-month, they're not able to make that change until the following month. Casey, please chime in if I missed anything on this slide. No, okay. So then we're moving on to pets.
All right, I think this one is mine. I wanted to just give some updates on pets. I know we talked about pets very early on in the pandemic. There has been some new research out about transmission with pets. The first cases in the United States for a positive test was a zoo tiger in New York, a New York City zoo tiger. I'm not sure if that's him or not, or if it's a random tiger, but he doesn't look very ill. But so there is evidence at this point of transmission from people to animals and to their pets. They assume that the animals at the New York City Zoo got it from zookeepers who came in with the virus. Cats and dogs can get it from people, but there seems to be a very low risk of animals giving it to people, of the transmission going the other direction. Exception to that is mink. They've found that mink can not only spread it to other mink, but possibly also spread it back to people. Cats and dogs that aren't spreading it to other cats and dogs, and not any evidence at this point of it spreading to people. So please don't allow your participants to get rid of their pets to decrease their risk of COVID. That's not a good reason to get rid of a pet, especially right now where they really need their pets. So, and so until we know more about this, people should be treating their pets as they would another human family member to protect them. So if somebody is sick, they don't have the pet in the room with them if possible. Trying not to handle them if they're sick, that kind of thing. Apparently there is not a lot of animal testing happening. So if somebody wants to have their dog tested, there's not vets doing that. The CDC does recommend that pet owners limit their pet's interaction with people outside their household. So not letting your dog run around at the dog park and interact with a lot of different people. I guess potentially they could get the virus from someone else. Keeping cats indoors, keeping dogs on the leash, 6 feet away from others. And then of course, avoiding large public places. So just like all of us, we need to avoid mass gatherings. They said no masks, pets do not need masks, and that could harm them. So I think that's it on pets. There is a chat on bubble packs.
If it looks like Carrie
on time
Carrie just added a resource to Meds on Time and Waterbury fills bubble packs for kidneys, and there's a $10 monthly fee associated unless you're straight Medicaid, and they do require a charge card on file for billing. Perfect. Thank you for that extra detail.
You can go to the next slide, Melissa. I wanted to talk about some new research out around alcohol use during the pandemic. Overall frequency of alcohol consumption has increased about 14% among adults over age 30 this spring versus the same time last year. It was most evident in adults 30 to 59, women, and non-Hispanic whites. As we know, alcohol use in older adults increases the risk of falls, medication interactions, weight gain. It replaces good calories and good nutrition if people are drinking instead of eating, can increase blood sugar, worsen mental health, and increase the risk of suicide or other risky behaviors. So this is definitely a concern. We have an infographic, which is the next slide, this is an infographic, which I really love, but it's Canadian, so it has some Canadian resources on it. We're working on trying to get a SASH version of this. And what I love about it is that it kind of attacks the problem in a lot of different ways. One being breathing exercises, some signs and symptoms that you are experiencing stress or anxiety, and then suggestions on what to do. Which really connects with a lot of the things that Dory was talking about, is staying active, staying connected, finding balance, and being kind to yourself. But I think some really important highlights of this is to monitor people should be monitoring their use. How much are you drinking or using cannabis or using other drugs, and keep track of that. And is it connected to stress, or is it, what's feeding that? Avoiding stockpiling. If it's there, people are more likely to use it. So not running out and stockpiling. And of course, to encourage folks to reach out for help if they start to identify a problem. There was a guide from, I think it was again an NPR, a guide to surviving the winter, and one of the things in it was there were 3 suggestions. One being get a flu shot, and the third being get a therapist. That's just something we're all going to need for the winter. So, but reaching out for help in some way. Certainly, it doesn't need to be a therapist, but some sort of connection and somebody who can support your participants. We are, like I mentioned, we are working on changing this into a handout that we can share with people, and we'll get that to you as soon as we can.
Casey, there's some other great resources still coming in about bubble packs. So it sounds like someone thinks maybe the community health pharmacy does bubble packs as well. And then Genoa Pharmacy, which I've never heard of before, but it sounds like that's a statewide resource for bubble packs. And then Diana shared that Kinney's maybe not the best choice because she had heard that they were putting each individual medication in its own bubble pack. So if you took 20 meds, you'd get 20 different bubble packs instead of grouping them all in a day. So just wanted to share that as well.
You can go to the next slide, Melissa. And to let you know about a webinar from UVM, COVID-19 holiday celebrations and flu season while we wait for a vaccine. Most of the UVM webinars have been really helpful. So just wanted to call that one out. There's lots of webinars that are posted on our calendar right now. And this one will be added there too. Next slide. So I wanted just to acknowledge how difficult it is right now for a lot of folks, both our participants, but also our staff, all of you who are out there every day doing this work, and at the same time trying to manage children, manage the hybrid classes, the sick days, the mental health of our children. I know personally, I am so thankful that school has restarted. My 11-year-old is no longer pretending to be a dog, since that was her only playmate from March on. She is now acting like a child again. So, and I think that the mental health effect on our children is certainly really wearing for, and hard to manage for all of us who are parents. The COVID scares in our communities are certainly trying as well. And I think that we don't realize how much this virus is affecting our everyday support network and how much it's affecting every little thing we do. Not just that we have to wear a mask in the grocery store, but the ability to ask a grandparent to carpool, to get our kids to school, or to ask a neighbor to carpool with them. Every time we try to get some help like that, we are increasing the risk for somebody, either our own family or that person. So every connection there increases somebody's risk. And certainly I've heard from people and in reading about this subject that a lot of parents just feel like they're doing everything badly, trying to manage both work and family. And also, of course, a lot of families are struggling economically with job losses. And so I just wanted to call this out, as I'm sure a lot of people, a lot of our coworkers and our coordinators and our nurses are struggling in very different ways as we show up every day and try to provide for our participants. We also need to take care of each other.
Casey, and I would say too that this article that you referenced here talked about parenting, but I think the same could be true for any kind of caregiving as well. I mean, just pretty much anything like that. So if you're caring for a spouse or a partner or an aging parent, or any of the number of people in our lives that we may care for, I think that this would also translate. And I also heard a sobering statistic that I may have shared last time, but there's been a 30% increase in suicidal ideation among unpaid caregivers in a study that was done of unpaid caregivers just during COVID time. They did the study at the very beginning, and then they recently redid the study, and there was a 30% increase in suicidal ideation. So I just wanted to point that out too, that it is definitely taking a toll on people.
Absolutely. Thanks, Melissa. And so the next slide is really just a huge thank you to all of you who just keep showing up despite all of this that you're carrying around on your back in your backpack. Thank you for our caring for each other and for caring for the participants and keeping SASH going.
Yes, thank you to everybody. And this slide, I love the visual of the backpack, Casey, because it's just like one more thing on your back. Thank you to everyone.
So for our quote of the week, kind of the whole, all the way through this call, we're talking about how we're in this for the long haul. There's really a long ways to go. The quote from Dr. Osterholm is, we really have another 12 to 14 months of really hard road ahead of us with COVID-19. And that's what I'm concerned about today. I don't go back and replay February and March. I play right now. So staying in the moment, but knowing there's a long way to go. So the two visuals we pulled out are there. All we have to do is hang on. And then if you feel like you're losing everything, remember that trees lose their leaves every year and they still stand tall and wait for better days to come. Which, as we're watching the trees lose their leaves, at least here in the Northeast Kingdom, I felt that was fitting. So I know we're done early today, but we certainly have time for questions, comments, or suggestions from folks.
And I would just mention too that we had talked about possibly going down to once a month for these calls and decided that, again, things just change so rapidly. We'd rather leave them every other week and keep them shorter if need be. So maybe they'll be every other week for a half an hour. We'll see. But thank you all for coming. And if you have any questions, please let us know. Otherwise, we will see you next week. And thank you all for your patience with Zoom while we figure this out.